السلام عليكم، الله يعطيكم العافية. اليوم راح نكمل آخر جزء معنا بقسم الاستماع في امتحان ال OET. وزي ما بتعرفوا عنوان الفيديو تبعنا راح يكون Do not do it right. Part C نوعا ما يعتبر الأصعب في امتحان الاستماع، بس هذا الحكي إذا أنت you do it right. بس إذا طبقت التكنيكس that we have here in this video، إذا طبقنا كل التكنيكات اللي موجودة ودربنا عليها كثير step by step، you will be able to get a high score. راح توصل لعلامة عالية إن شاء الله. أهم شيء do not do it right. طيب شو هو Part C؟ Part C عندي راح يكون عندي 12 questions مقسمين على 2 parts، Part 1 و Part 2. كل part فيه 6 questions. بالنسبة لأنواع الأسئلة هو نوع واحد multiple choice questions with 3 choices، يعني عندك 3 options، 2 منهم out وواحدة صح. الحلو في الموضوع انه الامتحان راح يعطيني 90 seconds to read through the questions، يعني راح يكون معك وقت كفاية لحتى تقرأ الأسئلة وتحدد برضو الكي ووردز وتنتبه كثير منيح على الأوديو. بالنسبة لأهم التكنيكات اللي راح نستخدمها في الامتحان، طريقة حل الأسئلة راح تكون عبارة عن triangle، مثلث. اوكي، أول إشي راح نبلش بقراءة السؤال، نحدد الكي ووردز بالكويستشنز، وبعد هيك بننتقل على النقطة الثانية. النقطة الثانية أي سؤال كوبي بيست دايركت تسمعه بالاوديو زيه موجود كوبي بيست بالاوبشنز، على الاغلب هذا الاوبشن بكون غلط. بعد هيك بننتقل على النقطه الثالثه. يفضل انه في حال كان السؤال نوعا ما صعب نشتغل على الاليمينيشن، ان نحاول ان نبعد الاجابات البعيده عن الجواب او اللي ما ذكرت او الكوبي بيست، بعدين نختار الاجابه الصح. هيك بتكون اضمن واقرب للاجابه. اوكي بيرفكت، عرفنا التكنيكس، ناو ليتس ابلاي ذم. خلينا نبلش تدريب عليهم وخلينا نشوف على اللابتوب. ليتس جو. اهلا وسهلا فيكم ببارت البراكتس. وزي ما بنعرف بارت سي بده شوي تركيز، عشان هيك حاول ابعد عن الديستراكشنز المشتتات. اهم شيء لما تبلش تدريب او لما نروح على الامتحان ما نكون كثير تعبانين او عامل دبل شيفت بالشغل وجاي تتدرب. هذا الاشي will not work, so you need like really تكون ب good environment للتدريب لحتى انت تكون مركز 100%. مش بس هيك، كمان الامتحان حاول تكون انت امورك 100% نايم منيح ورايح وجاهز. وتأكد النجاح زي ما بنعرف إجباري مش اختيار. بالنسبة لشكل الامتحان ببارت سي رح يحكي لك في الامتحان you will listen to 2 different extracts، كل extract عليه 6 questions. أنواع الأسئلة رح تكون multiple choice questions زي ما هو حاكي هون، وبرضه رح يكون عندك 3 choices A و B و C، واحدة منهم هي الصح. تمام؟ Then, in this part of the test, you will hear health professionals talking about aspects of their work. Basically, رح تكون just introduction، ما رح يكون إشي كثير deep or difficult to understand، فالأمور ممتازة. ننتقل لآخر تكنيك معنا اللي هو أنا بسميه plan B smart. في حال إنه أنت ما عرفت الإجابة بالمرة، أعطي C then move. سي واطلع، سي واطلع. اوكي، بس مش كل اجاباتك يكونوا سي. في حال انه انت ما عرفت الجواب كان صعب نوعا ما سمعت الاوديو، اعمل سي وضلك طالع. listening techniques زي ما حكينا سي واطلع، بس هذا الحكي ما راح يجيب لك علامة عالية، ممكن يطلع معك واحدة ثنتين صح. اوكي، basically the technique that we're going to talk about اللي حكينا عنه بداية الفيديو اللي هو التراينجل. اوكي، وأول تكنيك معنا راح يكون عبارة عن read the question and simplify. شو يعني simplify؟ بسط السؤال على أساس إنك تكون حافظه كلمة كلمتين، أول ما تسمعه بالأوديو تعرف إنه الإجابة موجودة هون. Then we move to the next stage اللي هو أي option عندك بكون copy paste من الإجابة، يعني بتسمعه بالأوديو copy paste أو كان direct answer. على الأغلب إحنا بنتعامل مع part C اللي هو الأصعب بالlistening، عشان هيك راح تكون الإجابة غلط، ما راح تكون صح، لأنه راح يكون تراب إنه تارك لك إياه على أساس تختارها وخلاص. Then we move to the next stage اللي هو بقرأ التشويسز اللي عندي، بعمل elimination للإجابات الخطأ، بحذف الإجابات الخطأ وبعمل confirm للإجابة الصح. كيف بدي أعمل elimination؟ well basically أي سؤال copy paste حكينا is out. أوكي، وفي عندك option على الأغلب ما راح يكون mentioned اللي هو part of the option، ويظل عندك واحدة صح، فأنت بتعمل elimination وبتختار الإجابة الصح. بس هيك جربها أكيد راح تزبط معك. بالامتحان راح يجيك هيك part C in this part of the test، هذا قرأناه قبل شوي. تمام، then you start with extract 1. طبعا راح يكون عندك questions 31 to 36. Now look at extract 1. هون extract 1 questions 31 to 36. طبعا هون راح يحكي لك بالضبط عن الثيم او المين ايديا اوف ذا conversation. طبعا عندك اسم النيرس زي ما انت شايف اللي هو ساندرا. تمام، وعندك اللي هي work with prostate cancer، وبرضه عندك including مثلا patient a man called Harry. اوكي، بيرفكت. هذا الاشي رح تسمعه بالاوديو فما في داعي انك تقرأه، بس it's good to know about عشان تعرف انت ايش الاشي اللي رح يكون معك بالكويستشنز المين ايديا وهيك. بالنسبة للكويستشنز زي ما بتشوف قدامك عندك بارت سي 31 to 36، هيك بتيجي الأسئلة كلها تحت بعض. راح تسمع بارت باي بارت. راح يكون عندك أول إشي الانسرز ار ان اوردر، بس المين ايديا الفكرة الأساسية بهذا الامتحان إنه في عندك راح تسمع الأوديو كامل. طبعا هي راح تكون في كويستشنز وراح يكون الأمور واضحة من ناحية الانتقال من سؤال لسؤال، بس إنه الفكرة وين؟ إذا ما قدرنا نلحق نقرأ كل الإجابات أو سوري كل الكويستشنز مع التشويسز وهي الأشياء، أوكي، في تكنيك نستخدمه لحتى نضمن أعلى علامة. Yes, we do have one. Okay. Well, basically أنت حاول اقرأ 31, 32, 33, reach until 34, 35 والأخير just use plan B smart. أوكي. لأنه على الأغلب you need like to understand، مش بس إنه أنا أقرأ وأحدد keywords. فإذا كانت قراءتي بطيئة مثلا وما لحقت أكمل كل التشويسز اللي موجودة عندي وكل الكويستشنز، بستخدم هذا التكنيك. مش بس هيك كمان I'll try to answer مش plan B smart بس، بحاول answer while listening، يعني وأنا بسمع بحاول أعطي الإجابة الصح لموضوع اللي هم الكويستشنز اللي أنا ما لحقت أقرأهم. طبعا ما تنسى إنه معك 90 seconds to read the questions 31 to 36، يعني very enough، يعني إن شاء الله إنه يكون الوقت كافي. مع التدريب بصير الأمور أحسن. حاول again to understand, analyze, underline keywords عشان تكون أنت up to the point direct with your answer. أوكي، هاي الشغلة رح تساعدك كثير إنك تفرق معك بين إجابة صح وإجابة غلط، especially لأنه السمع اللي هو بيعطيك الكوبي بيست زي ما حكينا راح يكون تراب، وهي لعبة ال OET بالlistening part C. قبل ما نبدأ تحليل بالأسئلة اعمل باوز للفيديو، جهز ورقة وقلم، اعمل أجواء هيك إنه على أساس إنك أنت تتدرب على هاي الأسئلة 1,000,000%، لأنه بعد هيك بعد ما نخلص التدريب راح نبلش بتحليل الأسئلة which is something really great. راح نبلش تحليل question by question، نشوف ليش الإجابة هي صح وليش باقي الإجابات كانت خطأ. وأهم شيء تذكر دائما do not do it right هاي بالامتحانات. ليش؟ لأنه فعليا doing it right راح يعمل لك مشاكل بالunderstanding، فحاول ركز على التكنيكس in order to get the highest score possible. Okay, so basically do not do it right, do it our way and you will see the difference. I'll start the audio in 1, 2, 3 and go.
Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear a presentation by a specialist cancer nurse called Sandra Morton, who's talking about her work with prostate cancer patients, including a man called Harry. You now have 90 seconds to read questions 31 to 36.
My name's Sandra Morton, and I'm a specialist cancer nurse helping cancer patients deal with their diagnosis and treatment. I'd like to tell you about the type of work I do, and particularly about one of my patients recently diagnosed with prostate cancer. Let's call him Harry, to illustrate the sort of things I get involved with. Now, before we get on to Harry, I'll give you a bit of background. Clearly, my job covers many aspects of patient care, but what's the priority? Firstly, prostate cancer is in fact the most common cancer in men in the U.S., with almost 300,000 new cases diagnosed every year. That's a staggering number. One problem is that this type of cancer actually develops very slowly, so there may be absolutely no sign that you have it for years. So if we're going to reduce the number of cases, it's vital that people like me get the word out to as many men as possible, that we tell them how to spot the signs of prostate cancer, like an increased need to urinate or straining while urinating. Unfortunately, the cancer can be at an advanced stage by the time patients come in for tests, at which point the available treatments are far less effective. So, let me tell you a bit more about my patient, Harry. Like many middle-aged men, Harry was offered a routine health check at his local doctor's office. As far as he was concerned, he had no particular health problems or obvious symptoms at the time, and so he almost ignored the invitation. But he'd promised his family he'd look after himself. His partner had died of skin cancer some years before, so he felt obliged to go. It was during his appointment that, based on a few symptoms he mentioned, Harry's doctor decided that he'd need further investigation for prostate cancer and referred him to a specialist clinic at the hospital. Harry's trip to the clinic started with a routine blood test, which initially showed a slightly low hemoglobin level. A further test then revealed that his PSA, the prostate-specific antigen, was high at 20. He then saw a urologist who conducted a digital rectal examination and biopsy, a procedure that I always try to explain to patients may be uncomfortable, but is entirely necessary. In fact, though, Harry said the 3-week interval between having a biopsy taken and hearing the outcome was far more of an ordeal. Harry told me that when he went to see the urologist to get his results, he immediately sensed he was in trouble. Although the urologist was very considerate in delivering the news, unfortunately, the indications were that Harry did indeed have prostate cancer. He was assured that the cancer was low grade and not aggressive. Harry had suspected the worst, and though he'd tried to prepare himself for it by doing some online research, finally hearing that confirmation was still a shock. In fact, the very mention of the word sent Harry into panic, which was very unlike him. So at the time I first met him, he was very vulnerable and grateful to have someone to talk to. Of course, the response to the illness amongst prostate cancer patients like Harry can vary enormously. I've dealt with some men, for example, who haven't really realized the importance of keeping up their medication because they've felt relatively well, especially if they've been experiencing unwanted side effects. Unfortunately, though, any break gives the disease the perfect opportunity to spread into the bones, making it much more difficult to treat, and a successful outcome less likely. And some treatments do cause some unfortunate effects, such as erectile dysfunction, which some men really feel uncomfortable discussing because it's a sensitive issue. Other patients have mentioned that even though they've been given a lot of help, it's still difficult to weigh up the pros and cons of the various treatment options they're offered, from ultrasound or radiotherapy right through to radical prostatectomy. So responses like these need to be taken into account by specialist nurses when talking to patients. For me, these factors really underline the importance of the community follow-up clinics we have in my area, which address many of these issues in the provision of health care for cancer patients. Staff at these clinics see patients during their recovery and only send them back to hospital for treatment if they develop significant new symptoms. Seeing patients in the clinics means staff get to know each patient and build a relationship with them, which enables nurses like me to dispense advice and answer questions. And although we have no firm evidence, staff feel that's far more beneficial to patients than attending a large hospital clinic. So we're hoping more clinics like these can become available.
Did you answer all the questions? Well, that's amazing. خلينا نشيك إجاباتنا مع بعض. Step by step, question by question. Question 31. What does Sandra Morton see as the main aim? هذا الإشي اللي نركز عليه in her work. Okay. معناته إذا بدي أعمل simplification, aim, work. Okay. طيب. Option 1, to inform patients about the different treatments on offer. Or option B, to publicize the availability of tests for the condition. And C, and D, to raise awareness of the symptoms of the illness. What do you think? Well, the correct answer is C. Okay, to raise awareness of the symptoms of the illness. طيب ليش? Why C? طيب حكى هنا to raise awareness of the symptoms. هنا بالبداية my job covers many aspects of the patient care. But what's the priority? هنا إذا بننتقل لبعد هيك هون it's vital that people like me get the word out. شو يعني get the word out؟ اللي هو to spread the word، يعني إننا نحكي. Okay? تمام؟ To as many men as possible that we tell them how to spot إنه يعرف the signs of prostate cancer. عشان هيك raise awareness is the correct answer. طيب ليش مش A؟ هسا A كانت incorrect because her main goal is awareness not treatment guidance. ومش C لأنه she highlights symptom awareness بدها الناس تعرف الsymptoms مش diagnostic tests. Question 32. When Harry was offered a routine health check at his local surgery, he initially A. resisted the idea due to his wife's experience, B. felt he was too fit and well to be in need of it, and then C. only agreed to attend because his doctor advised him to. Okay, well, basically the correct answer is B. Okay, so why B? Well, basically هون بحكي لك felt that he was too fit and well to be in need of it. Okay, لما ننتقل هون راح يحكي هون as far as he was concerned he had no particular health problems or obvious symptoms at the time, and so he almost ignored the invitation. اوكي زي ما بنلاحظ هون انه المعنى يتوافق مع B عشان هيك B is correct, and اذا بنلاحظ برضه is not copy paste answer هو عبارة عن المعنى بالمعنى. اوكي فهذا الاشي بدنا نركز عليه. ليش A is incorrect؟ لانه Harry almost ignored the invitation because he believed he was healthy زي ما حكى هون انه no obvious هون symptoms at the time. اوكي عشان هيك كان بفكر حاله healthy اموره تمام خلص ما في داعي. ليش C is incorrect؟ هون بحكي لك only agreed to attend because his doctor advised him to what? To visit. Okay, well, basically هون بحكي لك Harry decided to go himself due to a promise he made to his family. مش للدكتور هون هيا. But he'd promised his family he'd look after himself. Question 33. During Harry's investigations for prostate cancer at a hospital clinic, what is the correct answer? Well, basically, the correct answer is B. He found it hard to cope with the wait for some results. Why? Because in the audio, it mentioned that having a biopsy taken and hearing the outcome was far more of an ordeal. Ordeal معناها إنه زي مصيبة أو كارثة. Okay? عشان هيك الجواب can be found it hard to cope with the wait for some results. طيب ليش مش A؟ لأنه بالأوديو حكى إنه taking a biopsy يعني maybe uncomfortable بس ما هذا الحكي ما كان ينطبق على هاري يعني specifically. يعني ممكن يكون found it like unpleasant ممكن لا الأمور طيبة يعني. أما بالنسبة لأوبشن C was not mentioned يعني wasn't given in the audio. Okay, so the correct answer again is B. Question 34. What was Harry's response to being diagnosed with prostate cancer? Well, A, he found himself reacting in a way he hadn't anticipated. B, he was unconvinced by the prognosis he was given. And C, he immediately researched treatment options online. He went online and searched for some answers. Okay, perfect. So, what is the answer? Well, the correct answer is A. But why A? Well, basically, طبعا هو بحكي الchoice عنا he found himself reacting in a way he hadn't anticipated. وبالأوديو حكى
In fact, the very mention of the word sent Harry into panic, which was very unlike him.
يعني ما كان على طبيعته يعني بس سمع you know like he was acting differently. Okay, so that's why. Okay, طب ليش مش B؟ لأنه الaudio states that Harry was assured the cancer was low grade, okay, and not aggressive. Well, basically he was like convinced somehow, okay? مش إنه موضوع هي عكسها, okay? ليش مش C برضه؟ لأنه his reaction was like the panic initial the first one, and then he looked for you know some answers. بس إنه بالبداية كان أول reaction له إنه he found himself like reacting in a way he hadn't anticipated. Question 35. What typical patient response to the illness does Sandra mention? Option A, unwillingness to commence appropriate medication, B, failure to seek advice regarding different treatment options, or C, reluctance to talk about the embarrassing aspects of a treatment. Well, the correct answer is C, okay? But why C? C is like reluctance to talk about the embarrassing aspects of a treatment. وهنا بالaudio حكى which some men really feel uncomfortable discussing because it's a sensitive issue. Okay, so it matches like option C. Okay, for that reason, C is the correct answer. But why not A? Because the audio mentions some men not realizing the importance of medication, but not necessarily being unwilling to take it. Why not B? Well, in the audio, it states that patients struggle to weigh up treatment options, but this does not mean they fail to seek advice. Question 36. Well, Sandra believes that community follow-up clinics are important because they, option A, offer patients more personal aftercare. B, are proven to be less traumatic for patients. C, provide rapid treatment for patients developing new symptoms. Okay, the correct answer is A, but why A? Option A, offer patients more personal aftercare. وبالأوديو حكى seeing patients in the clinics means staff get to know each other or each patient and build a relationship with them, okay? Which enables nurses like me to dispense advice and answer questions اللي هو building a relationship, which is basically more personal aftercare. Okay, so why not B? لأنه بالaudio states that staff feel community clinics are more beneficial, but it also clarifies that there is no firm evidence for that or to support this, okay? عشان هيك it contradicts, تتعارض مع الفكرة, okay? أما بالنسبة لسي طبعا الأوديو mentions that patients return to hospitals for significant new symptoms, meaning community clinics do not handle urgent care directly. مباشرة تحويل transfer على الهوسبيتال. Okay, perfect. خلينا نجرب نحل هذا السؤال مع بعض. هذا السؤال يعتبر very difficult. إذا بتحله صح خلص ما تكمل الفيديو. اقرأ السؤال منيح، ركز على simplification، صغر السؤال، احفظه، ركز على الكيوردز كمان والتكنيكات اللي حكينا عنهم بهذا الفيديو. راح أبدأ بالأوديو مباشرة، فأنت حاول اقرأ السؤال قبل وراح أبدأ in 1, 2 and 3.
Today we're talking to Dr. Jack Robson, a cardiologist and Chagas disease specialist in the USA. Dr. Robson, what is Chagas disease and why is it referred to as a neglected disease?
Chagas is caused by a parasite called Trypanosoma cruzi. Most sufferers become infected when they're bitten by an insect, commonly known as the kissing bug, which carries the parasite.
Right.
People often don't realize they've been bitten, and during the initial phase of the infection, symptoms are normally mild or absent.
Okay.
70% of those infected never develop complications. For the other 30%, the disease tends to remain silent for a long time, often 30 years, but it eventually enters a chronic phase characterized by serious cardiac, digestive system, and neurological disorders. About 7 million people worldwide are thought to have Chagas, but it attracts relatively little publicity or funding for research. This indifference is largely down to it being primarily a disease of marginalized communities in Latin America, where it's endemic. You need resources to force significant action.
Right, I see.
Okay, so what is the correct answer? Well, basically, the correct answer is A. Because of the social groups, it mainly affects. Okay? طيب ليش؟ زي ما احنا شايفين هون, but it attracts publicity وfunding research etc. هاي هي الجواب هو هون, لأنه بتصيب part وعشان إنه ما في أصلا funding وما في إنه للريسيرش وهاي الأشياء, فعشان هيك كان جواب الصح A. Okay, let's try question 32. جاهز؟ اعمل pause, اقرأ السؤال. راح أبلش الأوديو in 1, 2, 3 and go.
To force significant action.
Right, I see. And are there any concerns in the USA about Chagas?
Yes, the insect carrying the parasite is actually endemic to the southern U.S. states. Since 1955, however, no more than 30 people have been bitten and infected while in the USA. The alarming thing, though, is that it's become apparent that large numbers of first-generation and some second-generation immigrants from Latin America carry Chagas, around 300,000.
Right.
These people won't infect others, apart from congenitally and possibly through blood transfusion, but a significant proportion end up chronic.
Okay, perfect. The correct answer is B. Okay, why B? Because it's mentioned here. Let me just use the pen. Okay, you will find the answer right here. Okay, let's try this question. And as you know, pause the video, read the question, and I'll start the audio in 1, 2, 3, and go.
Well, this year, a Bolivian woman, let's call her Marisol, asked me if she could be tested for Chagas. She's a long-term U.S. resident, but she'd recently been on vacation in Bolivia, and at one point she had felt unwell. This often occurs with changes in diet and living conditions, and that's what Marisol assumed was the cause. She'd actually been planning to donate blood in Bolivia, but changed her mind at the last minute. Ironically, if she'd gone ahead, the screening would have detected Chagas.
I see.
Hearing from relatives that Chagas can be transmitted congenitally was what prompted Marisol to come to my clinic. She and her partner wanted to start a family, and she was scared that she might pass the parasite on. Tests then showed she did indeed have intermediate stage Chagas.
And what issues can arise in treating Chagas?
Well, another patient...
Okay, perfect. All right. So the correct answer is A. But why A? لأنه هنا حكى إنه she and her partner wanted to start a family and she was scared that she might pass the parasite on. Okay? So basically, she was worried about the health of any children she might give birth to. Okay? Question 34. Okay, again, pause the video. I'll start the audio in 1, 2, 3, and go.
Well, another patient, I'll call her Jennifer, felt unwell following a vacation in a region where Chagas is endemic. Tests indicated she was Chagas positive. Jennifer was then referred to my clinic where we do further tests. Meanwhile, she looked up Chagas online and understandably was distressed by what she read. "Why me?" she once said to me. She was also fearful about taking benznidazole, the main drug used for Chagas, because it has potentially harmful side effects. For optimum impact, it should be taken in the first 2 months of the disease, but by the time the testing had been completed, 10 weeks had passed since the likely date of the bite. For information, Jennifer took benznidazole.
The correct answer is C. Do you want to know why? Well, I wrote it down here. So the correct answer is C, as you can see. Okay, C. All right, here. Okay, so basically بنقدر نقرأ هذا الإشي. Okay. بس في شغلة اللي هي لما حكت why me هي فعليا did not refuse to accept her diagnosis. عشان هيك الموضوع مش إنه rejection، عشان هيك B رح تطلع عنا غلط. فالجواب الصح هو C. خلينا نجرب هذا السؤال. اعمل باوز للفيديو، اقرأ السؤال. I'll start the audio in 1, 2, 3 and go.
And do you deal with patients in later stages of the illness?
Yes, I have a 62-year-old patient called Juan. 8 years ago, he was diagnosed with dilated cardiomyopathy, and Chagas was also detected in him. If he'd been tested for Chagas earlier in his life, his long-term prospects would have been better. A year after the diagnosis, Juan was found to have type 2 diabetes. This was dealt with relatively well, though his body did initially reject insulin. Juan took drugs for his heart, and for several years was reasonably stable, but eventually monitoring revealed severe cardiac deterioration. His experience is very much what you'd expect in someone who's had the disease for years, and it's reached the latter stages. There's no cure, and the main recommendations are...
The correct answer is A. But why A? Let's see. Here we can find the answer. The correct answer is A, as mentioned. Okay. And let me use the pen. Okay, A. And why not other options? You can find them here. Question 36. آخر سؤال راح يكون معنا بالتدريب بهذا الفيديو. اعمل pause للفيديو، اقرأ السؤال عشان حبلش الأوديو in 1, 2, 3, go.
I see. And what can be done to combat Chagas generally?
Plenty. Researchers are working on improved drugs to treat it and a vaccine. None currently exists, but it takes at least 10 years to supply a new drug. Another idea is to develop the existing drugs in tablets of different sizes. That could and should be done almost overnight. What's currently available is designed for adults, even though infants often have the disease. There are also some very important programs using insecticides and other methods to wipe out the bugs that transfer Chagas to humans, but initiatives like those take decades rather than years.
Well, Dr. Jack Robson, thank you very much for speaking to us today.
The correct answer is B. And don't forget إنه بالسؤال طالب منك short-term priority. Okay? So basically the correct answer again is B. The explanation that we have is right here. Okay? Thank you very much for watching my video. And again, إذا بدك past papers امتحانات سابقة اكتب لي بس free practice بالcomments ويا ريت تزودني بإيميلك عشان أبعث لك الفري practice that we have here. بالتوفيق لكم والله يعطيكم العافية.